You brushed your teeth this morning. You made your coffee. You felt completely normal. And that feeling is exactly what makes this so dangerous. Most people your age wake up every day feeling fine, and assume that means their colon is completely fine too. Here is what nobody tells you clearly. Colon cancer in its earliest stages produces almost no warning signs at all. You can feel perfect, and something serious can already be developing. By the time your body sends obvious signals, the cancer has often progressed further than we want it to. But there is something that changes everything, and I am going to show you exactly what that is, when you need to act, and why waiting for symptoms could cost you years of health you did not have to lose. If this resonates, please subscribe to The Healthy Habit and turn on notifications so you never miss this kind of honest information. I'm Dr. Gerald Mark, and I have watched colon cancer caught early become completely manageable, and I have watched the same cancer caught late become devastating. Here is what matters. Colon cancer is one of the few cancers where early detection genuinely changes everything. Caught early, the 5-year survival rate is 91%. Once it spreads, that drops to 13%. And here is something that might surprise you. According to the National Cancer Institute, colon cancer is now the #1 cause of cancer death in people between ages 20 and 49. Cases in people under 55 have doubled over the past few decades. Most people do not catch it early because they are waiting for symptoms that do not arrive until the cancer has already progressed. I want to tell you about Renata, who came to me at 63 thinking she was in perfect health. She felt great. No problems. No symptoms. And that assumption almost cost her everything. Your colon is not like your heart or your lungs. It does not send obvious pain signals when something starts growing inside it. Think of your colon like the walls of a house. Termites can work quietly inside for months before you see damage on the outside. By the time you notice the wall buckling, the damage is already extensive. A tumor can develop in your colon, grow slowly, and produce absolutely no symptoms because the colon has very few pain nerve endings in its deeper layers. And just like with termites, the inspection that finds nothing wrong is the best news you will ever receive. That is exactly what a clean colonoscopy gives you. Renata was 63 and had just retired. She had booked a trip to Portugal with her sister to celebrate, something they had planned for years. She exercised regularly, ate well, had no family history of colon cancer. Her bowel habits were regular. No blood in her stool, no weight loss, no pain. She felt perfect. At her annual physical, her doctor asked one simple question. Renata, when was the last time you had a colonoscopy? She had never had one. She felt so good that the thought had never occurred to her. 3 weeks later, after her first colonoscopy, her doctor found a polyp. Not cancer yet, but a polyp with changes indicating it was heading that direction. It was removed right there during the procedure. Renata walked out with her life completely intact, her health protected. But if she had waited for a symptom, if she had kept believing that feeling fine meant she was fine, that polyp would have continued growing. She made it to Portugal, she celebrated, and she lived the retirement she was planning, without the shadow of something she never knew was developing. The most common early sign of colon cancer is actually no sign at all. Complete absence of symptoms. Most people assume if something serious were happening inside their body, they would feel it. That assumption is wrong. Colon cancer can be substantially developed before producing any symptom that brings you to a doctor. Persistent change in bowel habits. If you have always been regular and suddenly you are constipated for 4 weeks straight, or if you have developed new diarrhea that does not go away, that deserves evaluation. A study published in Gastroenterology found that a persistent change in bowel habits lasting longer than 3 weeks was present in approximately 40% of colon cancer cases caught at earlier stages. If this changes and stays changed for more than 3 weeks, call your doctor. Unexplained weight loss. If you are losing weight without trying, without any change in how much you are eating or how much you are moving, that is different, and that needs evaluation. Not just for colon cancer, but for other things as well. Start tracking it. Bring it up at your next appointment. Blood in your stool. Many people see blood and assume hemorrhoids. and then they do nothing. Blood in your stool should always be evaluated. Always. Even if you are pretty sure it is just hemorrhoids. You cannot diagnose the difference by looking at it. If you notice bright red blood on the toilet paper, or in the toilet bowl, or mixed into your stool, make an appointment. Get it checked. Dark or black stools. That dark color usually means bleeding from higher up in your digestive tract, but it can also come from the right side of your colon. Either way, black or very dark stool needs to be evaluated. Do not assume it will go away. I want to stop here for a second, because what I am about to tell you next is the one that most doctors forget to connect to colon cancer. Iron deficiency anemia. Some colon cancers bleed slowly, just a little bit every day, and you never notice any obvious blood. But over weeks and months, that small amount slowly depletes your iron reserves. If you have been diagnosed with iron deficiency anemia, especially if you are a man, colon cancer absolutely needs to be ruled out. If you are a man, and you have been told you have iron deficiency anemia, your doctor should be actively ruling out colon cancer. Men do not lose iron the way women do through menstruation. So iron deficiency in a man has far fewer innocent explanations. A study published in the American Journal of Gastroenterology found that iron deficiency anemia was the presenting symptom in approximately 15% of colorectal cancer cases in adults over 60. If your doctor does not mention screening for colon cancer, you need to bring it up. A persistent feeling that you have not completely emptied your bowel. Even after a bowel movement, you have this lingering sensation that there is still stool in the rectum. You feel like you need to go again. This sensation can signal a tumor pressing on your bowel wall. If this is new for you and it does not go away after 3 weeks, bring it to your doctor. Persistent bloating or gas, lasting more than 3 weeks without any dietary change. This can signal a partial obstruction developing. If you suddenly have persistent bloating and you haven't made any recent dietary changes, or if the gas and bloating persist for longer than a few weeks, that is worth mentioning to your doctor. But here is the point that changes everything. Most people with early colon cancer have none of these symptoms. None. Renata had none of these symptoms. She felt perfect. And she almost missed her chance to prevent this cancer because she was waiting for her body to give her a sign that might never have come. And this is no longer just a conversation for people over 60. The fastest growing group being diagnosed with colon cancer right now is adults in their 30s and 40s. If you are watching this and you think this does not apply to you yet, it might already. Drop in the comments right now, what is actually stopping you from getting screened? Is it fear of the procedure? Thinking you are too young? Or just that nobody ever told you it was urgent? I read every single comment personally, and what you share directly shapes the next videos I make. I call this the screening window framework. Identify your risk category, average risk or higher risk, with family history or inflammatory bowel disease. Know your screening window. Age 45 for average risk. Earlier, if you have risk factors. Know your screening interval. Every 10 years for colonoscopy if normal. Annually for stool-based tests. Choose your screening method. Colonoscopy is gold standard, but stool-based tests work too. Commit to the schedule. This is a lifelong pattern that protects you. First, grab your phone right now and open your calendar. Block 1 hour to call your doctor's office this week. That single action is the difference between intending to do this and actually doing it. Second, start paying attention to your baseline, your bowel habits, your energy, your weight. If something changes and stays changed for more than 3 weeks, call your doctor. Third, if you have ever noticed blood in your stool and dismissed it, make an appointment and tell your doctor about it now. You now understand why screening matters more than symptoms. You know exactly when you need to start screening based on your age. You know that screening is not a response to fear. It is an act of genuine self-protection. You came into this video uncertain. You are leaving equipped with a framework, a specific action, and a calendar with a blocked hour. Renata felt perfect, had no symptoms, and yet a polyp was quietly growing inside her colon. She made it to Portugal. She lived the retirement she was planning, without the shadow of something she never knew was developing. You are now part of a community of people who make the choice every single day to show up for their own health. That is not the majority. That is something genuinely different. If you have a son, a daughter, a sibling, or a friend between 35 and 55 who has never been screened, send them this video right now. Not later, right now. That one action could genuinely save their life. Please subscribe to The Healthy Habit and turn on notifications. Now here is my question for you. What is the first step you are going to take this week? Will you call your doctor to clarify when you should be screened? Drop that in the comments. That commitment is what separates the people who protect their health from the people who hope it works out on its own. Small habits, done consistently, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Build one healthy habit today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.